And so they had to come up with a new one so that they continue their powers and their authority and their additional funding. That's why this happened. This is not about a new sudden outbreak. What's been going on in the Democratic Republic of Congo involving monkeypox has been going on for decades.
Hello everyone, Alexa here in Mexico City. And why I came all the way here? It's because Rebel News asked me to come here and give the voice to conservative leaders who took the stage during the CPAC, the Conservative Political Action Conference that was held in Polanco, Mexico. I had the chance to engage with Robert Malone. So Mr. Malone is a really well-known physician in US. He is also an expert in mRNA, and during the COVID-19, he just wanted to warn the public about this injection that was given to millions of people around the world. I spoke with Malone with the latest health issues as the monkeypox and disease X and the fear spread by the WHO. We also spoke about the censorship, so you don't want to miss the whole interview. This is exclusive to us. But before, I need your help, because it's not free for independent journalists to travel all the way down and to give the voice to those experts. So please go over rebelcpac.com and make a donation. Thank you in advance, and now you need to watch this beautiful interview.
We have lived through, in the States now, 2 years of propaganda and promoted fear of avian influenza, something which has been in Europe and in the United States and in Mexico for many, many years. It's very important to do anything I can to speak to as many people as possible. I'm trying to share information, and Mexico in many ways is the leader of Latin America. Mexico has done a great job really during the COVID crisis. It's continued to sell ivermectin. It's in many ways been a bastion of medical freedom. And I have spoken here in Mexico before. I spoke to the Senate about the vaccines, and it's been my pleasure to participate in the community here. And I'm a native Californian, so Mexico has always been close to my heart.
What do you make of the FDA giving emergency use authorization to yet another COVID vaccine on August 22, 2024?
And what was fascinating about that was that the person in charge of vaccines at the FDA, Peter Marks, when he was speaking about this, he repeatedly used the term hope, that they hope that this will work. They hope that it will work better than the other ones. They don't actually have the information. This is not really ethical to deploy this based on hope rather than scientific data. They don't have the data and the information from clinical testing to support their claims, and yet they're still recommending this all the way down to babies based on their hope that it might work and that it might not be as toxic as the other versions.
Can trust in health institutions, in healthcare, in public health be restored? Or has its reputation been destroyed?
When the panel said, listen, give it to 6-month-old babies with zero assurances this possibly would be safe. I said, where were you the day when the WHO came out and said, do not use remdesivir in the hospital? I'm Dr. Peter McCullough. Join me for an evening together. Tickets are on sale now.
You can't deny that all over the world, public health and medicine have been severely damaged. The faith in people, in pharmaceuticals, in the pharmaceutical industry, in vaccines has been severely damaged. Can it be rebuilt?
I don't know how that happens quickly. Trust, once it's damaged, takes a long time to restore. And they have abused the trust of the public egregiously. And I don't see how, without just massive propaganda, they're going to get back to a place where the public is willing to trust them anytime soon.
How do we get back to medical ethics with true informed consent where people know exactly what they are being injected with?
How do we get back to medical ethics is a good question. And really underneath your question is, how do we get back to a respect for patients, which is to say a respect for people? Because that's what's been broken here, is what we've been subjected to is a system of beliefs that there are people who know better and that we should just blindly trust them. And we should go along with their recommendations and their mandates and their enticements to do things without really them respecting us and providing us with true information to allow us to make our own decisions. And I don't know how we fix that. The problem is that we have a group of oligarchs and their corporations that believe that they know better than us and that they have the right to tell all of us what to do and to really disrespect us as human beings. And that is going to be very difficult to fix.
What are your thoughts on monkeypox, diseases, and the WHO having sole authority on declaring public health emergencies of international concern?
Right. So I've followed the monkeypox story quite closely now for 2 years. I've written many, many essays about it, and recently multiple essays about what's been done at the World Health Organization. I believe that this is a form of cronyism. I call it disaster cronyism. And it is also a form of terrorism. I call it psychological bioterrorism. It is the use of fear, the weaponization of fear of infectious disease to support other agendas. Now, right now, the World Health Organization is seeking additional power and additional authority. And so it's in the interests of Mr. Tedros and the World Health Organization to scare the public. And that seems to be what they're doing, because monkeypox is not an international threat. It is not a disease of international concern. There is one case outside of the Democratic Republic of Congo and the surrounding nation states in Africa. There's one case in Europe, and that happens to be somebody who was infected in the Democratic Republic of Congo and then traveled back to Sweden. Okay, so it's an imported case of monkeypox. That's it. Okay, and the claims about the death rate of 500 people, mostly children, those are false. Those are children that have multiple medical problems, not the least of which is they're malnourished, and they have immunodeficiency as a consequence. They also have, some subset of them have had monkeypox. We don't really know how many. But this is being promoted by corporate media as a source of globalized fear. And you have to ask yourself, who benefits from this? Mr. Tedros benefits from it, additional money, power, influence. And the biopharmaceutical industry benefits from it. The people that hold biopharmaceutical industry stocks, the people that make monkeypox vaccine, the people that are trying to develop monkeypox drugs. Here's something that most people don't realize. Mr. Tedros himself acknowledged the whole reason for this new announcement of international public health concern is because the old one was expiring on the 20th of August. And so they had to come up with a new one so that they continue their powers and their authority and their additional funding. That's why this happened. This is not about a new sudden outbreak. What's been going on in the Democratic Republic of Congo involving monkeypox has been going on for decades. Monkeypox exists in animals that live in the Democratic Republic of Congo, not just monkeys. And it infects human beings that eat those and are in contact with those animals. And that will be the case for as long as there is a Democratic Republic of Congo, as long as there is a Congo, as long as there are people that eat bushmeat, we will have monkeypox. It is not anything new. It's not something to be afraid of, even though the media, who's the other group that benefits from this, is so actively promoting all this fear.
Mm-hmm. And how do we restore everything if voices like you are being censored, licenses are being removed, and nobody give them a voice in the mainstream media or other like big channel where most of the population is watching?
Well, this is why we have alternative media like Rebel News, and why we have X and other social media outlets, because the corporate media is increasingly becoming obsolete. Its business model is failing. It's largely subsidized now by the pharmaceutical industry, and it's dying. People are learning that they can get true information from other sources, and if we want to make it so that true, accurate information can get out to the people, what we have to do is support groups like Rebel News and Elon Musk and X, and resist all of these efforts to censor and propagandize and use these modern tools of psychological warfare on people. We have to be allowed to be free. As Javier Milei said, freedom, damn it. That's how we get around this.
I've been sent here in Mexico City to cover the CPAC, the Conservative Political Action Conference. I came here because it was important for us to give the voice to those conservative leaders here in the Latin world. But of course, there were other speakers. But it's not cheap to travel all the way here, and I need your help because all of you, we can do all this. Thanks in advance to go over rebelcpac.com to chip in what you can and to watch my report, my hard work on the ground. So I repeat, rebelcpac.com, and thank you for donating, same if it's just $1.